Hello and welcome to Digital Medboard. Here we go. If you touch the posterior pharyngeal wall, you activate the cranial nerve 9, glossopharyngeal nerve, which sends a signal to its sensory nucleus, the nucleus tractus solitarius. This nucleus then stimulates the motor nucleus, the nucleus ambiguus, which activate cranial nerves 9, 10, and 11, resulting in a sudden swallowing movement known as the gag reflex. If cranial nerve 9 is damaged, it leads to dysfunction of cranial nerve 10, resulting in the loss of gag reflex, which is seen in the Wernicke syndrome. In Wernicke syndrome, cranial nerves 9, 10, and both cranial and spinal part of 11 are affected. The hard palate is the anterior portion of the palate, while we palpate the soft palate, specifically the uvula. Palpation of the uvula or the posterior pharyngeal wall stimulates the cranial nerve 9. The primary muscle of the tongue is the genioglossus muscle. The epiglottis is the lid covering the larynx. Inferior to the epiglottis are the false vocal cords and the true vocal cords present within the larynx. When examining a patient from a frontal view, instruct them to open their mouth. Then use a tongue depressor to palpate the posterior pharyngeal wall, uvula, tonsils, or posterior one-third of the tongue, all of which are supplied by cranial nerve 9. To access cranial nerve 10, vagus nerve, ask the patient to say "ah." When they do, palate muscles contract, causing the uvula to elevate in the midline. This examination doesn't require physical contact with the patient. In a patient with the cranial nerve 10 damage, the uvula deviates away from the affected side. If the uvula is deviated away to the right, this indicates a left-sided vagus nerve injury, as the left side of the palate sags, while the right side elevates. We got a question. A patient was admitted with skull-based trauma and difficulty in swallowing. The doctor was touching the marked structure. Which of the following cranial nerve is being tested? Based on our discussion, difficulty in swallowing suggests gag reflex loss. The doctor was touching the marked structure, indicates the soft palate, which stimulates cranial nerve 9. Therefore, option B is the correct answer. That's the end of the session. If you found this video helpful, don't forget to like, share, and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Cheers.